Welcome to another Healthy Communities podcast. I'm Dr. Phil Huang, Director of Dallas County Health and Human Services. And today we have a special guest, Leonor Márquez, who is the CEO at one of, the largest FQHC, federally qualified community health center in Dallas, Los Barrios Unidos. So welcome. Thank you for being here.
Thank you, Dr. Huang. It's such an honor to be here.
Great. Well, first, can you tell us a little bit about your background and what brought you to this work?
Sure. Well, I was born in Texas. I never miss an opportunity to work that into the conversation. But I grew up in Phoenix and became a social worker, went to Arizona State, and then got my MSW in San Antonio. And I thought I would be a counselor. I thought I would be a clinician in the mental health field for years and years. Well, very early in my career, I really learned that I had a knack sort of for the business side. And so I learned more and more about that. In fact, one of my first jobs out of graduate school was at a community health center at an FQHC in San Antonio, and felt that I really, really learned and had a knack for the billing systems and the IT systems and that kind of thing. So I really toggled over to be an administrator. And so that led to a career at Parkland for a few years. And for 20 years now, I've been at Los Barrios Unidos Community Clinic. And it is just a passion of mine. Wow. So lucky to be there.
Well, we're glad you're here and have been here for so long in the community. So what's something people might not know about, like the role of federally qualified community health centers, or even, might even explain to some people what they are?
I will. So we are considered a federally qualified health center. And so some people call us FQHCs, or they call us community health centers or community clinics. Whatever you call it, we are a neighborhood clinic. We are I like to describe us as a family doctor with extras. Okay, so in the case of our clinics, we see all ages. So we see newborn babies, just days old. We see children. We see teenagers. We see adults. We see elderly people. We do prenatal care. So literally all of the lifestyles, all of the life cycles. I will say that probably the majority of what we do is women and children. We've got a very big prenatal care program. We do about 1,700 deliveries, or at least the prenatal care that results in about 1,700 deliveries. And then very busy newborn practice and very busy pediatric practice.
And your physicians from there do the deliveries, or?
We, no, we do the prenatal care. In the years past, we used to be part of the delivery system and the call groups, but anymore it's, we do the prenatal care, and then they tend to deliver at Methodist Hospital or at Parkland. But we do the prenatal care from the very first pregnancy test to about when they go into labor.
Okay.
Some other things that we do at sort of the extras, I talked about the sort of the doctor's office. Plus, well, we also have behavioral health care, very integral part of what we do. We have dentists. We've got a WIC program. So it's not just primary care. It's not just medical care, but we have these extras. So that's what makes us different.
That's really a broad spectrum of services. Now, who is the population then that you typically serve?
Okay, so the typical population tends to be moderate or low income. The vast majority, I should say more like 90%, are at or below the poverty level. And those that have insurance, it tends to be Medicaid or CHIP, which is the insurance that poor families qualify for. We do take all kinds of insurance. Probably 90%, 92% Latino. We welcome all. We feel like we're equipped to handle many, many cultures. I will say that our name, Los Barrios Unidos Community Clinic, sort of implies that we're the Latino clinic. And that's an image that we're sort of proud of, but it's like, no, we welcome all. In fact, just a few years ago, we went through a rebranding. We're still the same organization. We were founded in 1971, so we've been around for 54 years. But a few years ago, we felt like, well, we're not. We want to make sure that people understand we're open to everyone. So we rebranded to LBU Community Clinic. So you'll hear us use Barrios Unidos or Los Barrios Unidos Community Clinic, or LBU Community Clinic, or La Clínica. All of those mean Los Barrios Unidos. All are welcome. The folks walking through the door, little more than half of them do not have health insurance. So, which is, it's tough getting healthcare without health insurance. They could come to a clinic like ours, but surgeries and specialty care gets very complicated.
Okay, so you're able to provide the basic services and things for underinsured, uninsured.
Correct.
And then you
all ages.
Refer to some other specialty clinics or resources if
that
needed.
Is correct.
So
that's absolutely correct. That gets very complicated when they don't have insurance because they can't necessarily pay a $400 or $500 consult fee. When they come to the clinic, we offer care on a sliding fee scale. They don't have health insurance. They don't have CHIP or Medicaid or Medicare or any of the other marketplace plans. We offer care on a sliding fee scale basis. So it's deeply, deeply discounted. And then, if they can't even afford that, we're not going to hassle them. It's more important that we see them.
Okay. Any stories you want to share about, anonymously, of course, but anything about, maybe the type of patient or experience of coming to your clinic that?
Actually, I have a recent story. Just today's Wednesday, so just a couple of days ago, a mom with a couple of little kids came to the clinic, and she had walked into the wrong building. She was looking for the dental clinic, and I happened to be, going that way. And so it's, half a block away. I said, well, I'll walk you there. And she had, her child was a 2-year-old who was going to see the dentist. And I think the daughter might have been 5. And we're just chatting. And I said, have you ever been here before? I wanted to know if she knew Dr. Ruiz, our dentist. Oh, yes, I like him a lot. I really like coming here. Everyone's very sweet and very nice. And my children used to be afraid of going to the dentist. They're not anymore. They really like him. And she kind of smiles. I used to come here as a kid. This is where my mother brought us.
Wow.
When we were little. I said, you're a kid from the neighborhood. Well, I live in Waxahachie now, but I still come to this clinic. I love hearing that story.
That
Things
is
like
amazing.
that. We
Yeah.
have second generation patients. We have second generation employees. I love that. Mothers and fathers that work there and their kids work there. That just speaks to the trust in the community. That speaks to how welcome we are to be in the community.
Yeah, that's a great story.
Love it.
What are some of the biggest challenges that you're seeing in the community now?
The biggest challenges, I'd say on the healthcare side, what our community is going through is what really all communities go through, heart disease and cancer. It's killing our community, it's killing all communities. What's different is in an impoverished neighborhood, it's happening 10 and 20 years sooner. So all the more reasons for prevention, all the more reasons to take care of yourself, to come in, to get care early diagnostic care so that we can, if there's something wrong, we can catch it early. So, those are diseases that are in really all communities, right?
Mm-hmm.
But it's sad that people that don't have health insurance or struggle to read and write, perhaps don't speak English very well and don't read English at all, really, really struggle with the healthcare system. Our healthcare system tends to be, somewhat difficult. And so navigating it when you have fewer resources can really have a detrimental effect.
Yeah. Now, we worked a lot together during COVID.
Yes.
Do you see other opportunities or, in terms of working with this at the health department here at DCHHS?
I do. Well, before we leave from the COVID topic, I have to say Dallas County was a godsend to us. We felt like we were we're literally a mile from here. Our clinic is just a mile from Dallas County. So we felt like we were at the center of the universe, that we had access to current, correct information. There was a lot of hype, right? And there was a lot of nonsense on social media, but we felt like we had access to the very current information, accurate, real-time information. So thank you. All of us are deeply, deeply indebted to you. But yes, so we will continue to work with you. We feel like we have a solid partner in Dallas County. We're part of the emergency response system. We pride ourselves on being prepared for things. And one of the things is emergency preparedness, whatever it is. Of course, there's healthcare things. Sometimes it's a utility thing, but we are proud to be a part of that. We are on your work groups and committees to end HIV. We're doing HIV testing at our clinics. We're doing PrEP care at our clinics. And we feel like you're a solid partner. We're grateful for that.
Yeah, no, we appreciate that collaboration, and it is so important. Any comments you might make about steps you're taking to serve people who face barriers like language, transportation, housing instability? Because these are, issues we certainly see.
So a lot of those things, unstable housing and lack of resources, not speaking the language, all those are all barriers to care. So what we do, certainly as LBU, but certainly FQHCs, we are about removing those barriers and doing the best we can. One of the best ways we can do that is have a clinic in their neighborhood. So all of our clinics, we have 6 clinics, and all of them are in, low-income neighborhoods. They're beautiful clinics. On the inside, they're beautiful clinics and state-of-the-art, but they're going to be in poor neighborhoods kind of by design. Even though we do telehealth and we make, video health available, a lot of care is still delivered in person, face to face, being dropped off at the clinic, coming on the bus. So we want to be in their neighborhoods. I would say for the language, we am very happy to say that almost all of our frontline staff speak Spanish and English extremely well, but we have access to something like 200 languages on a system, and it's a video system. And so the translator is on a video screen, and it's on a computer table that can raise and lower. So for sitting down, we can do that triangulation, the doctor, the patient, and the translator. So we make that work. So again, removing the barriers. I think I mentioned earlier about the sliding fee scale. Surprisingly, as sick as some people can get or as worried they are about their health, the first question is often, how much will this cost? So again, that's a barrier. The high cost or the fear of a high cost can be a barrier. So we want to work through those. Get them screened for insurance, because it could be that they qualify for one of the discount programs. They certainly may qualify for CHIP or Medicaid or even Marketplace.
Mm-hmm. Yeah. You talked about cost being something you're hearing and questioning.
Yes.
Are there any other common questions or concerns that you're hearing out in the community now?
I think in recent months, there's sort of a fear that is keeping, that's another barrier, quite frankly, a fear of societal fear. Fear of people leaving their homes because are they going to be profiled? Are they going to be, pulled over? As much as we say the clinic is safe and that you're going to be treated very well while you're here, they still worry about the getting there. So yeah, I do worry about that. We do hear from patients that, I'd rather kind of go without right now. I'm feeling fine, which worries us because diabetes doesn't necessarily hurt, right? Hypertension doesn't hurt like a pain necessarily. But they're saying, you know what, I'll just wait till I get sick. And so that really bothers us. So we try to do everything we can to encourage them to see the doctor.
Mm-hmm. Yeah, now we're seeing the impact on some of the attendance at some of our clinics and things too, which is really concerning. Yeah, very concerning. So are there any thoughts on how people in our community can get more involved, maybe to either as patients, volunteers, advocates, to improve health?
Well, I would say take care of yourself. That's seriously one of the best things you can do. Healthcare is comprised of genetics, right? The genes that we were born with. That's a big part of your healthcare. But so is what you eat and what you smoke or don't smoke, and what you drink and how you move. A whole lot of it is not just seeing the doctor, not just taking your meds. A whole lot of it is all of these other things. And some of us don't have good habits. So one of the best things you can do is take care of yourself. take care of your mind, take care of, do some, the self-talk that's going to help you get through your day, through your job, and take care of what you eat. And go to the doctor. Even if you don't have health insurance, even if you don't live super close to a doctor, Dallas, it's been my experience that Dallas is an extremely generous city. There are free clinics. There's a safety net system that's very robust, it's very strong, and very high quality. So take care of yourself. If you're one that wants to talk to advocates and talk to your elected officials, by all means do that, because it's very important that part of what you're doing is using your voice to convey your concerns.
Yeah, no, definitely. And we're all facing a lot of challenges with the things that are going on at the federal level and funding. Any comments on how it's affecting you all and what we need to do or what can be done?
So we, in our 54 years that we've been around, we've had our ups and downs, and we've had some disturbing news come from Washington in the past, and we've been through different times that we thought, okay, well, this will be extremely hard to get over, and we always get over it. Now, I will say in every case, we have to kind of step back. Okay, what's really going on, and how can we continue to fulfill our mission? Because it's not like we can't afford it. It's not a no. It's like, yes, we can do it, but how? We're going to have to pivot, right? We're going to have to, guess what? Do more for less. Unfortunately, nonprofit organizations are very good at that. I will say at LBU, we are undeterred. We are here to fulfill our mission. We've been here 54 years. We will be here decades to come.
So yeah, again, that's a great way to face these challenges. Any other things that, despite these challenges, make you feel hopeful about, the future here with what we're dealing with? I
have to say, when I'm having a bad day, I go and spend some time in pediatrics. I'm like, okay, no, we've got a lot of hope for our future. I talk with some folks that are, living hand to mouth, or, doubled up with their sister, living with their sister because they can't afford it. And they're extremely resilient. They can bounce back. They have bounced back. And it's like, wait, that's kind of the family I came from, right? I mean, we didn't have a ton of stuff. I didn't even know what insurance was when I was a kid, but, our family, kind of overcame all of that. And it's not about, complaining. It's not about feeling sorry for yourself. A whole lot of it is like, you have a brain, you have a family that loves you. And there's some things that are completely in your control. And so I never lose sight of that.
Yeah, no, definitely visiting the pediatric area and seeing the kids and the youth is probably the most hopeful.
It absolutely is.
Yeah,
it absolutely is.
Now, if you could change one thing about our healthcare system tomorrow, what would that be?
Oh, Dr. Huang, if I could, I would do it. If it would be a overnight, I would. I guess one of the things that's frustrating is healthcare in this society is paid for largely by health insurance, right? You go to the doctor, you hand the folks your insurance card. For the most part, that's how it's done. And I don't mean at clinics, I mean everywhere. That's mostly how it's done. Well, where did that insurance come from? Mostly from employers, right? And quite frankly, the larger the employer it generally means the better insurance, because you've got economies of scale. So what does that mean for the entrepreneurs who maybe have a small business and can't afford, to have health insurance? All of those things. So wouldn't it be great if it were unhinged from employment? That we have a system that we pay for. We'll have to figure out how to pay for it. I have the ideas. I don't have the way to pay for it, but wouldn't it be great if you had health insurance in a way that wasn't necessarily dependent on your employment? Mm-hmm. I would change that.
For everyone.
For everyone. That's right. That's right.
And that's what they talk about, so the model, everyone gets a basic sort of level of healthcare, like public schools or something like that. And people, they want more, they can get that, but having that basic sort of.
You have the basics.
Mhm.
I have a friend from Canada. It's been years and years, but we talked about that. And she said, well, so-and-so doesn't have insurance. We're talking about someone in the family. It's like, what do you mean? Wait, what does that mean? Well, so we gotta wait till payday until we can take the kid to the he was just floored because it doesn't work like that in other places. And I'm not here to say that there's a perfect way and a way to do it, but there shouldn't be so many barriers to getting healthcare, especially for a little kid.
Yeah, definitely. So last question, what inspires you most about working in our community or with your FQHC? And then is there a final message that you would want everyone to take away from this?
What inspires me, every single day I get to see our customers really working hard and coming in, taking care of their families. I'm also really, really inspired by the clinicians and my staff. We've had some issues with the heat. We've had some air conditioning problems, but we don't close the clinics. You just don't do that. And so, we don't put anyone at risk or anything like that. But sometimes we have to move from the clinicians from here to another one. And literally that just happened a couple of days ago. And everyone still smile. Yes, we can. Si se puede. Come on in. We'll see you. That's really inspiring because that's really unusual. And the easier thing to say is, let's just close. It's too much. No, we'll figure it out. That's inspiring. Lasting message. I think, you hear us clinics referred to as an FQHC or federally qualified health center. What on earth does that mean? It's a type of clinic. We're actually a private nonprofit organization. We're freestanding. We've got 6 clinics, but we are our own boss, if you will. We're governed by a board of directors that's anchored in the community. The majority of our board are patients, which makes us very in tune to the community. But I will say, whether you call us FQHC or La Clínica, Los Barrios Unidos, or Dr. Huang, whoever your doctor is, that we are there for you. We are there for you with insurance, without insurance, whether you're, came in late because you couldn't get off early because the boss is after you, whether you're a walk-in, all of those things, we are here for you. And I want people to understand that.
Well, thank you so much. Thank you for everything
You're
you do in our
welcome. Oh, my
community.
goodness,
and thanks
you.
for being here with us today. So,
You're welcome. It's a real honor, Dr. Huang. Thank you.
Thank you. So thank you all for joining us for our Healthy Communities podcast. Be sure to like and subscribe to our channel and join us next time when we talk about more public health issues in Dallas County.